So as I told you, in this topic we will be mainly focusing on what are the main respiratory disturbances, or we can also call the respiratory disorders which are affecting our body or mainly lungs, and also about the effects of smoking. So to begin with, the first disturbance or disorder is hypoxia. Now here you can hypo means low, oxia means referring to oxygen. So definition part you can see here, it's a condition where tissues are deprived of adequate oxygen, that our body cells are not getting enough oxygen, and that will be leading to a situation in which they won't be able to work properly. So that will be leading impaired. Impaired means not proper. The working is affected, or that is the meaning of the word impaired. Impaired means bad functioning. So that is how we are defining this hypoxia, a condition where tissues are deprived of oxygen, and so that they may not be able to work properly. Now below that you can see what are the major causes of this. The first cause is that it is high altitude. That is when we are in a high altitude. For example, we are normally living in this area. We move to Munnar area or Kodaikanal area or more high altitude like Darjeeling, Simla. Then what will be happening is that we won't be getting sufficient oxygen, because we are normally used to or adapted to living in a lower area. So when we move to those area, especially to a mountainous area, and this mountainous area normally contain less oxygen, because as we move up in the atmosphere, the amount of oxygen or amount of air gradually decreases. So that will be there. So at a higher altitude, there will be lower oxygen level or oxygen pressure, so that the people may not be able to get sufficient oxygen. So that is one situation where hypoxia or low oxygen and availability will be occurring. So that is one situation. Another situation is the case, situation like emphysema. In this emphysema, the ability of the lungs to exchange oxygen with the blood is actually gradually reduced. So that is the problem with emphysema. Then another problem is chronic bronchitis. In the case of bronchitis, I will show you a picture of bronchitis, how this bronchitis will be appearing. Because bronchus, you know what are bronchus, and it's basically an inflammation of the, see here you can see that. So this is what is actually happening in the case of a bronchitis. See here you can see this is the normal wall of the bronchus, and this is the trachea, and trachea is dividing into bronchus, etc. And if you take the inner wall, this is how normally the inner wall of the bronchus will be appearing. Now here is you can see that there is some inflammation or swelling inside the bronchus, and that will be reducing the what is called inner diameter of this bronchus, so that lesser oxygen may be able to pass through it. So that situation will be also leading to a lower oxygen availability. So here the second reason is that presence of some lung diseases like emphysema or chronic bronchitis. Then third situation is carbon monoxide poisoning, because carbon monoxide is a very colorless, smellless gas. It doesn't have any odor or color. Then most of the time this carbon monoxide is produced when we are burning. For example, we are burning fire, and also from automobile exhaust there will be carbon monoxide. So this carbon monoxide has one feature. It has a higher attraction to hemoglobin than oxygen. That is, if there is carbon monoxide and hemoglobin will always bind with the carbon monoxide. So that is a problem. So if in presence of carbon monoxide, hemoglobin will not be binding with oxygen first. Before binding, it is going to bind with the carbon monoxide, which has a higher attraction. And as a result, what happens is that hemoglobin will not be carrying our oxygen to various cells and tissues. So that in presence of carbon monoxide or situation known as carbon monoxide poisoning, our hemoglobin may not be transporting sufficient quantity of oxygen to various cells and tissue. And that situation also leads to lower oxygen availability for cells. So that is another reason for hypoxia. Then anemia. In this anemia everybody knows. It's a we normally say low blood. The blood is very low. Actually, it is the number of RBC as well as number of amount of hemoglobin that is actually reduced. If RBC is reduced, hemoglobin level in your blood is also reduced. So that makes blood difficult to carry. So that blood doesn't have sufficient hemoglobin, and in such a situation, blood will not be carrying sufficient quantity of oxygen to various cells and tissue. So that is another reason. So anemia is the fourth reason. So coming to hypoxia, it is simply a low oxygen availability to cells and tissue, and there are four principal reasons for that. And they are high pressure, they are living in high altitude, lung disease, carbon monoxide poisoning. Then fourth one is the anemia. Then how this hypoxia is affecting? What are your effects on your body? Normally it will be leading to fatigue. Fatigue means tiredness, breathlessness. Breathless, for example, you are not getting sufficient oxygen or sufficient, you are not able. That means your body will be trying to take more oxygen. That is known as a breathlessness. Cyanosis. Cyanosis means the skin and lips can get blue in color because of the presence of more amount of deoxygenated blood in your body. So that is known as a blue coloration of skin and lips. Impaired brain functioning. Brain needs pure supply of oxygen. So if oxygen supply is reduced, that will be leading to brain damage. So that is the problem, and prolonged hypoxia can result in coma. Coma means unconsciousness. Then after a period of unconsciousness, death can happen. So this is the problem of hypoxia. Initially it will be causing some cyanosis, and gradually it will be leading to organ damage as well as brain damage and death. Now what is the response body? How body will be responding to it? Normally our body will be increasing the breathing rate. For example, when we move to Munnar area and we are living there for 6 months, we can see that our breathing rate has actually increased. And this is an attempt by the body. Since there is less oxygen there, our body will be trying to compensate by increasing our rate of breathing, so that our body will be taking more oxygen than the usual. So that is the attempt. That attempt by the body to increase breathing rate is known as hyperventilation. Hyperventilation means you are taking more air. And second is the increasing heart rate. Heart rate is also that more blood will be pumped into the various cells and tissue. Because if the blood is containing less oxygen, by pumping more blood, so that more RBC and more hemoglobin may be reaching the cells. So that is the purpose of increasing heart rate. Then increased RBC cell production. So that is also a picture. For example, if you compare the RBC level in our area or in a high altitude area like Munnar or Darjeeling or Simla, etc., the people constantly permanently living in such areas, such high altitude area, at a higher level of hemoglobin, higher level of RBC. So that is because it is an attempt by or adaptation by our body to cope up with the low oxygen availability in the atmosphere. So this is how body will be responding to situation of hypoxia. Now we move to the second situation, that is hypercapnia. Now coming to hypercapnia, first we will understand what is the meaning of the word hypercapnia. Hypercapnia is a condition of excessive carbon dioxide in your blood. So that your blood will be containing more carbon dioxide. That situation is what is known as hypercapnia. Now we will see what are the causes of hypercapnia. One is hypoventilation, low breathing rate. So that is the shallow or slow breathing, often due to lung disease like COPD, chronic obstructive pulmonary disease. This is disorder, that is known by the name COPD, or other neuromuscular disorders can lead to this situation. So here the breathing rate will be very slow, so that the body may not be able to pump out the carbon dioxide sufficiently. So some amount of carbon dioxide may be retained in the body or in the blood. So there are number of reasons for that. One reason, another is an obstructive sleep apnea. That is intermittent pauses in breathing. For example, you are sleeping normally, even during sleeping, the rate of breathing is continuing. But sometimes in some people, there will be a short period of no breathing. So that is known as intermittent sleep apnea. There is absence of breathing, and this intermittent. Intermittent means after a period of some time. That is intermittent. So repeating after a very interval. That is the meaning of the intermittent. So in some people, this absence of breathing during sleep is known as a apnea. That can also increase the amount of carbon dioxide. That is, the body has to breathe continuously. If there is no breathing, two problems are happening. One is intake of oxygen will be prevented. Similarly, the expulsion of carbon dioxide is also prevented. So carbon dioxide content in your body will be gradually increasing. So that situation is known as obstructive sleep apnea. Then respiratory failure. Lungs cannot exchange gas effectively. So that also if the lungs is not working properly, the efficiency of the lungs has decreased. So that its ability to pump out carbon dioxide has decreased. That will be leading to carbon dioxide retention or higher carbon dioxide content in your blood and body. So here we have seen the causes of hypercapnia, and now we will see what are the effects of hypercapnia. Coming to the effects of hypercapnia, one is symptoms include confusion, headache, shortness of breath, and in severe cases, panic attack, seizure, loss of consciousness. So these are some of the major. For example, if there is higher carbon dioxide content, that will be creating in a milder situation, it will be creating headache, shortness of breath, etc. Then as the amount of carbon dioxide increase, it will be leading to loss of consciousness. And chronic hypercapnia can also lead to respiratory acidosis. Respiratory acidosis means the amount of carbon dioxide in your blood is increasing. This carbon dioxide will be combining with the water forming carbonic acid. So higher amount of carbonic acid in your blood means lower the pH, and that situation is known as acidosis. The acid nature of your blood, acidic nature of your blood will be increasing because of the formation of carbonic acid by the presence of carbon dioxide. So that is known as the acidosis. Then how body will be reacting or body will be responding to such a situation. Bodies attempt to eliminate excess carbon dioxide by increasing the breathing rate. So the problem for this hypercapnia is actually normally hypoventilation, low breathing rate. So to overcome that, body's response is that body may be trying to increase the rate of breathing so that more air is actually pumped out of your body. So that is the response of the body during an increased amount of carbon dioxide in your blood. And if this compensatory mechanism fail, there will be blood pH, that is pH of the blood become more acidic. So that is the pH drops leading to acidosis. The reason is that carbon dioxide combines with the water forming carbonic acid. It is this carbonic acid that is leading to increased acidity of the blood. So these are the situations that will be leading to hypercapnia and how body will be attempting to solve that. Now third situation is known as asphyxia. As A means stands for absence. So then a life-threatening situation where body is deprived of oxygen leading to suffocation. Means for example, when somebody is choking or holding on your neck, or some people when you are dying because of hanging. This situation is taking place. The body may not be able to take oxygen. Then that situation where body is deprived, that is body is not getting oxygen, that will be leading to suffocation and gradually death. So what are the reasons? One is physical blocking. For example, choking of food or foreign objects. When children are usually doing this, when small children, babies are taking some balls or other thing and ball gets stuck in your pharynx, so that the supply of air to your lungs may be hampered. So in such situation, the first aid is just by tapping at the back of the baby for some time and also pushing at the chest, pushing at the abdomen for some time. That may usually help you to remove this object from the pharynx. So that is physical blockage. Then drowning. For example, when we fell into the water, our body is not designed to take oxygen from water, so that we may not be able to breathe. Water blocks air entry into the lungs. So that is the problem. So that we cannot take air, and water will be blocking all this trachea, bronchus, and small tubes to the lungs, so that the air supply to the lungs may be hampered. Then strangulation, physical constriction of the neck, preventing airflow. Somebody is something is constricting your neck, so that the supply of air to the lungs may not be taking place. That is known as strangulation. Then exposure to toxic gases, like breathing in gases like carbon monoxide or cyanide. Earlier I told you, too much carbon monoxide, what will be the situation? That will be leading to carbon monoxide poisoning, because carbon monoxide will be preferentially combining with, attaching with hemoglobin, and cyanide is also highly poisonous gas. And cyanide will be immediately deactivating most of the important enzymes in your body, so that your body may not be able to take in any oxygen. Then what are the effects of asphyxia? Coming to the effects of asphyxia, the initial symptoms include gasping for air. That is, we are not getting air, so our body's attempt is we are gasping, we are for air, panic and cyanosis. Then followed by unconsciousness, seizure, brain damage and death if oxygen supply is not restored for a period of time. And this is known by the name asphyxia. So in the case of asphyxia, it is complete absence of oxygen, due to several reasons are physical blockage, strangulation, drowning, or exposure to poisonous gases like cyanide or carbon monoxide. So that is the third respiratory disorder. Now coming to what is carbon monoxide poisoning. So as we have been discussing about carbon monoxide poisoning for some time, carbon monoxide here you can see that has a higher affinity, higher attraction to hemoglobin. See, it has a better, carbon monoxide binds with hemoglobin 240 times more strongly than oxygen. So that is the reason why carbon monoxide can create a problem for us. It has 240 times more attraction, more affinity than oxygen, forming carboxyhemoglobin. The compound formed when carbon monoxide combines with the hemoglobin is known as a carboxyhemoglobin, which significantly reduces oxygen carrying capacity, because only oxyhemoglobin can carry the oxygen. So more carboxyhemoglobin forming in your RBC or in your blood means that your blood's ability to carry or transport oxygen may be reduced. So this is mainly the problem of carbon monoxide poisoning. Now what are the sources? Carbon monoxide is a very difficult gas to detect. Only because of using certain electric sensors only you can detect the presence of carbon monoxide. Inhalation of carbon monoxide, faulty gas heaters. Nowadays we are in our home, we don't use any gas for heater, but if you go to North India, during the winter time they will have to use this heater, and many of these heaters are either working on electricity or on gas. So if you are using gas heater, this gas heater can produce a little bit of carbon monoxide. That carbon monoxide can present in the room, and if there is no exhaust, because normally during winter time all the if you saw, for example, if you go to Munnar, there will not be any ventilation. The room will be, if the door is closed, the room is almost airtight. So in such a situation, the carbon monoxide, if it is leaked from some heater, it will be gradually increasing the concentration, and problem is that nobody can detect, no smell, no color, no feel. Only after some time that people will be realizing that they are facing the carbon monoxide poisoning. So then that is one way by which. Then car exhaust, smoke coming from automobiles, house fire, that improperly ventilated combustion appliances. Combustion means the vehicle appliances or burning appliances. So anything that is burning can create a little bit. For example, when you are putting fire at the backyard of your house, that fire also create a little bit carbon monoxide. So carbon monoxide, when a fire happens, some form of carbon monoxide is always produced. Problem with the carbon monoxide is that it is very difficult to detect. So industrial accident involving exposure to carbon monoxide. So these are some of the situations that lead to carbon monoxide poisoning. Now we will see what are the effects of carbon monoxide poisoning. Symptoms range from mild headache, dizziness. Dizziness means thalajuttal. That is the meaning of dizziness. Then nausea, confusion, weakness, blurred vision. We cannot see properly, and unconsciousness. So these are some of the problems associated with the effects of carbon monoxide poisoning. So if there is higher level of carbon monoxide poisoning, that will be leading to seizure, heart arrhythmia, the rhythm of the heart or beating rate of the heart is getting improper, and respiratory failure, death due to lack of oxygen. Because if all the hemoglobin is combining with the carbon monoxide poisoning, there is no hemoglobin available for transporting oxygen. That means cells are not getting a sufficient quantity of oxygen, and cells will die. That situation is the problem caused by carbon monoxide poisoning. So what we can do? Immediate removal of carbon monoxide source. For example, if you are removing if you are getting this carbon monoxide from some fire source, immediately remove the person from that area and administer 100% pure oxygen. Normally, if you are taking the oxygen present in our air, that contains nearly only 29% oxygen. But in the case of carbon monoxide poisoning, what our hospital doctors are doing is that they will be supplying 100% pure oxygen. And that 100% pure oxygen, especially from a higher pressure, can immediately replace the carbon monoxide from the hemoglobin. So that is a method that is used by doctors to pump out this carbon monoxide from your body. So under a higher pressure, if you are supplying 100% oxygen, that will be able to remove or replace this carbon monoxide which has attached with the hemoglobin, and so that gradually the oxygen will be able to supply or get transported to various parts of the body. And this is usually done in a pressurized oxygen chamber. There will be a cylinder and the person will be kept in that cylinder, and a supply of air will be given at a higher oxygen pressure. Then we have one more topic that is regarding the physiological effects of smoking. So coming to the smoking, the problem with the smoking is that it will be introducing numerous harmful substances into your body, impacting the various physiological symptoms, especially respiratory and cardiovascular system. So when a person is smoking, two systems are primarily affected. One is your respiratory system, like your nose, trachea, bronchus, lungs, alveoli, etc. They are all part of respiratory. Then your heart and blood. So these are the two major systems which are affected by smoking. And what is the chemical content of the smoking is actually nicotine. So nicotine stimulates the release of adrenaline, increasing heart rate and blood pressure. So that is the effect of nicotine. And the second effect of nicotine is that it will be constricting or contracting blood vessel, reducing blood flow to vital or important organs and peripheral tissues. So that when a person is smoking continuously for several months, several years, what happens is that sometimes the blood vessel get narrow, and so that enough blood may not be reaching the various organs, like end of the legs or end of the arms. So especially these peripheral part of the body may not be getting sufficient quantity of blood. That means they may not be able to get enough oxygen also. So that will lead to a cell death in such area. So that is problem of the smoking. Chronic exposure lead to addiction and withdrawal symptom, making quitting extremely difficult. So that is the problem of nicotine, because it is increasing adrenaline. So the person may feel some kind of freshness because of higher adrenaline output and increasing heart rate. And that is, if you are lethargic and person is smoking, that will be immediately releasing adrenaline. And adrenaline can have some effect on your body. And most of this effect of the smoking is actually because of the secretion of adrenaline. Then then another content of the smoke is a tar. Tar means the same tar, the black tar that people are using for road tarring. The same tar is also present in the smoke. And the tar consists of toxic chemical that damage lung tissue. It can adhere or attach to lung surface and paralyze the minute hair like cilia inside the trachea and bronchus, and which are clearing responsible for clearing the mucus as well as the waste from debris from the airways. So that is a function of this smaller cilia. The tar will be destroying all this inner wall of the respiratory tract. This leads to mucus buildup, so that the amount of mucus in the lungs will be increasing. There will be chronic inflammation will be there, and this will be leading to COPD, chronic obstructive pulmonary disease, such as earlier I showed you about this how bronchitis can happen. So that will be leading to bronchitis and also emphysema, where the alveolus of the lungs will be damaged. So these are some of the problems of the smoking. It will be leading to COPD, chronic bronchitis, and also leading to emphysema. Then another third content of the chemical. So one chemical that is present is nicotine. We have seen nicotine is mainly increasing the adrenaline rate. The problem with the tar is that tar will be damaging the inner wall of this respiratory tract. And coming to the third one, that is carbon monoxide. Smoking also produce carbon monoxide that will be reducing the oxygen carrying capacity of the blood by binding with the hemoglobin, making the heart work harder to supply oxygen to various cells and tissues of the body. Over time, this results in damage to the cardiovascular system, increasing the risk of heart disease and stroke. So that is the problem with the carbon monoxide. That is why, as I told you in the beginning, there are two major systems in your body. One is respiratory system, second one is circulatory system. Both these systems are very much affected by the smoking. Then long-term effect. So how this smoking can lead to major complication. Smoking is a major risk factor for lung cancer. With around 85% of the lung cancer linked to smoking. So that from that sentence you can see the lung cancer is quite rare in non-smokers. Only in people who are smoking, lung cancer can develop because of the presence of this tar and nicotine. Mainly tar is responsible for the development of lung cancer. Another disease is the chronic respiratory disease like COPD. Chronic obstruction. Obstruction means blocking of the pulmonary tract. That is mainly happening in the COPD. COPD progressively worsen, leading to reduced lung capacity. That is, ability of the lungs to exchange oxygen and carbon dioxide is gradually decreasing. That is known as a reduced lung capacity, and person may not be able to breathe properly. That is also another problem and leading to premature death. So this is the problem of the long-term effect of the smoking. Then you can also see that smoking affects the reproductive health. It can reduce the fertility in both men and women. So that is another major, especially if young people are smoking, their reproductive system may be adversely affected, often causing complications during pregnancy like low birth weight, developmental issues in the fetus. Sometimes the fetus may develop improperly. That will be leading to the formation of improper babies. So this is the problem, or this is the effect on the reproductive system. Then coming to the cardiovascular system or cardiovascular part, it will be leading to coronary artery diseases, stroke. Stroke means a rupture of blood vessel in your brain is known as a stroke. Then peripheral artery disease, that is the blood vessel supplying to the skin will be gradually damaged. So those areas may not be getting enough blood. So these are some of the problems associated with the long-term problems associated with the smoking. So here you can see that there are three major chemicals: nicotine, tar, carbon and monoxide, and these are the chemicals which are responsible for most of these long-term effects as well as short-term effects of the smoking. So this is an idea regarding what are the major respiratory disturbances smoking we have to mention: carbon monoxide and three other diseases like asphyxia, hypercapnia and hypoxia.